Now, turning to our program, I'm pleased to welcome Wendell Willis, Managing Director of the Bucks and Froedtert Health Equality Initiative, who will introduce our speakers. And we'll listen carefully because Wendell is introducing his bosses.
All right, everybody, be nice out there. Good morning, fellow Rotarians. Well, we're all in for a special treat today because many of you have been asking for the last 6 months what I've been up to since leaving the Milwaukee Public Schools Foundation. Well, the good news is we're all going to find out, including myself. So this morning, you get to meet two of my bosses, and they're the primary architects of a new Bucks and Froedtert endeavor. First, I'd like to introduce you to Eric Conley. He serves as the Executive Vice President of Froedtert Health and President of Froedtert Hospital, a 710-bed, $1.8 billion organization, 8,000 employees. He first joined the health system in July of 2018, and today as its president is responsible for the overall functions of the hospital. So as Peter would say, he runs a carnival, but Eric actually has to do brain surgery. Eric is a dynamic executive with demonstrated operational, strategic, and visionary leadership that spans over 25 years. And I won't go over the complexities of what he's managed, but trust me, he's been very transformational, but also had a top 10 U.S. News and World Report recognition. In addition to his professional endeavors, he's very committed in our community and beyond, serving on numerous nonprofit boards like the American Board of Orthopedic Surgery, the United Way of Greater Milwaukee and Waukesha, the American Heart Association, Livent Health, and the Leverage Network. My second introduction, well, I don't know if he really needs the introduction, is Peter Feigin, our World Championship President of the Milwaukee Bucks. I think we probably just need more of a reminder of what's happened since he's come to town. So we finally look at that place we call the Deer District. That was part of his vision, but the work doesn't stop there. Many of you may remember Michael Balat talking to us at our first Rotary meeting of the year, talking about their other real estate ventures and developments. And so part of that is what's come to fruition from Peter's vision and his management style. And much like Eric, Peter devotes a lot of his energy and effort into working with our community to make it better, both economically and from a social perspective. He's on the board of the Boys and Girls Club, the Milwaukee Public Museum, City Year, and our favorite education foundation, Milwaukee Public Schools Foundation. He's also spearheaded the development of the Bucks Foundation and served in a number of roles at the African American Chamber of Commerce, the American Heart and Stroke Association, and the board of CEOs Against Cancer. So it's very clear that these two have been impressive accomplishments on their own. But today they're here to talk about why they've come together to create really a transformation in our neighborhoods and make sure that we have prosperous citizens within our community. Welcome, Peter.
So Eric, we have a lot of fun doing this. So we have spent probably a few dozen early mornings on educational conversations with everybody. We'll tell you our story. The Bucks and Froedtert have unbeknownst to the world, a 20-year relationship contractually. Whether that's our medical office building on McKinley and 6, whether it's our sports science center, where we use as a training center, whether it's our sponsorship and media in our team, we have cemented one of the largest partnerships for the longest term possible. And I think what happened probably after we got about 5 years into it, we basically sat down and said, what's the legacy of this partnership? How can we affect change? How can we really think about what we're doing differently and leave the city of Milwaukee a better place after the next 2 decades? So we thought very, very big. We basically said, we're going to take a world championship global team that has an incredible platform, great media outlet, unbelievable access to wealth and resources, take the greatest hospital system in our area, form a partnership, and really go from the inside out. How do we target communities that desperately are disadvantaged, need some help, but do it a different way, in the way that really philanthropy and community activity has not been done for the last 20 years as we go forward. And Kathy Jacobson and Eric and a few others at the table, including our ownership, really sat down and said, let's try to make this happen. And this is really almost 2 years of work to really get it going. And for us, it's really implementing strategic systematic change like in our communities. And why? It's pretty easy. We think in the last 20 years, there's been limited change. Like we've been doing a lot of the same stuff. A lot of the same people have been donating to a lot of the same organizations, and we haven't affected things metrically in a big way. And Eric can take you through kind of other reasons why, because this is his slide.
So we do have a lot of fun with this, and as you can see, he is the better dressed up here this morning. So, when you think about the Bucks and Froedtert, the World Championship Bucks, and then where we are now with Froedtert Health and our academic medical partner, the Medical College of Wisconsin, what you have here in this community is really right now a top 6 program in the country. And so when you're looking for medical care, there's no choice than to come to Froedtert Health and Froedtert Medical College of Wisconsin. But this project is a lot more than that. Our why is to help these communities, help our community that we live and work in every day. So, as Peter said, there's been a significant amount of investment in the communities over the past 20, 25 years. And when you do look at some of the data points, there are small improvements, but there's still a gap. There's a significant life expectancy gap. And when we sat down and talked about what does this partnership mean, what do our organizations mean to Milwaukee, to Southeast Wisconsin, we need to close that gap. We need to do it in a systematic, thoughtful, investment-like way. And that's really been our why as we've gone through this. Talking with the owners and members of our health system team and our foundation team, it's like, let's do something different. Let's make this about the communities first and only. And so you see as we go through there who we're partnering with, who we want to partner with, working with all of you, really just to go about changing and reducing the life expectancy gap of the communities we live in. Because if we get that down, if there is no gap, then we are all better. The community is better and our organizations are better for it.
Yeah, and I think you got to really focus on the disadvantaged. This is not about healthcare, solely. This is not about education. This is not about food. This is about 360 degrees of how can we really affect change in 90,000 residents, like in the city of Milwaukee, through new home ownership, the poverty, improving like the poverty rate, median income, housing, unemployment. These are all things that, again, running this, for lack of a better analogy, like a business with data, with returns, with measurements that basically rate our success over time.
And as you see, the communities we've identified, largely because we have existing partnerships in those communities with anchor institutions. When I think of Howard Park, extremely partnering with Thrive On in that community, UCC in the Muskego Way area. We wanted to have communities where there was a partner, an anchor partner there that we could center things around. It's not the sole thing that will work though in those neighborhoods. This is about the entire community. But it is those areas that we can go to because the communities trust those organizations and we want to work through those. So we have these anchor partners, Silver Spring Neighborhood Center, the United Methodist Children's Center as well are the other partners that we're working with. And when we do look at the different projects that come out here, just like Peter said, we're looking at this as an investment. How will it work? And making some changes, but partnering with them and growing those institutions, growing the communities, again, with the intention of closing that life expectancy.
And one of the big kind of motivators here is these organizations do things right. These organizations have an unbelievable infrastructure already. How can we help them capitalize, scale, and scope their business in a big way? So 90% of their time is not spent on raising funds on a 6-month to 12-month basis. So they can't sustain programs. They can't grow their scale and scope because they're too focused on the everyday of what's going to happen next and their hand to mouth. So part of this is how from the community outward do we fund these centers that are doing great work and then bring our resources in to accelerate the growth.
We're not trying to duplicate, put funds on top of. We just want to enhance. This is a group effort. This is a community effort. When you talk about anything, whether it's health, violence, you look at these socioeconomic factors. That's what really drives everything. So we have to solve those things. When When I first arrived here, I was presented with an opportunity to work with 414 Life. And when you look at what we've done there, sort of the interruption of violence, when we sit down and we look at the different cases, it's still the same socioeconomic factors that impact violence and impact health. So this is just all in partnering with trying to address those barriers. Those are the barriers to health. Those are the barriers to the life expectancy gap. Those are the barriers to interrupt violence. That's what we have to really focus on and be intentional. Be intentional with it and partner, collaborate, not compete. You know, one of our partners in this whole initiative really is Aurora Health. Aurora Health, we compete, but we do not compete on the health of our communities. We just have to improve our communities. And that's what we're here really to kind of talk with all of you. We need your help as we talk about addressing the communities that we're serving.
And this is all about differently. So our role, we think we're the trusted conduit. Like we can bring these parties together. We can change the way we actually do the business of philanthropy and healthcare and community activation in ways that it hasn't been done before. And we're going to try this in a bold new investment with a tremendous amount of capital, with a real long-term sustainable growth. Like our investors, which are, as you'll see when we go through who's in this, are in for a decade. You know, this is not a one-time, 1 year kind of hit. This is a core group that is dedicated to affect change over a 10-year period of time.
Our partners are amazing. So the ownership, Gail and Jeff Ubilke, Jamie Dinan, and some of the other owners are all in this. And we structure this as a 2 10-year terms to get into to really address that gap. And partnering with the United Way, partnering with the Greater Milwaukee Foundation. Those are just some of the organizations we kind of socialize this with and wanted to ensure that we are working together. This is not about duplicating or competing. We want to work together with everyone. Again, putting the communities at the forefront.
And then you just think about where our goal is and how we can really kind of change our world. You know, and what we've done over the last 2 years is really focused a concentration of community leaders, the private sector, the public sector. We couldn't do this without the Milwaukee Police Department. We couldn't do this without our healthcare providers. We couldn't do this without the county executive health system and without the mayor of Milwaukee. So it's one of the first times in real times to create an equity fund that really includes all of those tentacles of the community that you really need to be successful. And I'd say one of the points of differentiation is, you know, those who are on the board are not just board members. Like there are 10 to 15 of us that are active executives in forming this, executing, and tactically, you know, moving the needle on this on a daily basis.
And it's really, as we said, with the communities, we sat down, we've had community conversations. I've had them, Peter had them individually, but together we sat down with most of these communities and listened, understood what it is they're asking for, and not trying to change that, not trying to say, well, we think you need this. It's, all right, let's walk through this. This is what you want to do. And then driving and shaping and moving it so that it's sustainable. Is what we're really trying to give. And given all the contributions of the organizations we talked about, contributions of many in this room, that's what we want to make sure we continue to grow and enhance so that the different projects in the communities are sustainable and, again, close that life expectancy gap. These are just our 4 pillars that we work through, and they're the basics, right? Housing, workforce development, childhood opportunities, and food insecurities. That's the basics, the basic aspects that we want to continue to grow and develop.
Yeah, and again, I think we take a strategy of what's our return on investment, what programs are established, how can we create programs that actually have a return. Again, like a very focused, you know, business-like approach to affecting change in the communities across all of our pillars, which are extremely important as we try to change the lives of these citizens, like specifically in these 4 neighborhoods.
So I think I just want to, at this point, we want to take questions, or are there other things we want to walk through?
Yeah, I mean, I could just tell you how we formed this, which is like the process has been pretty interesting. We spent a majority of the last 2 years in the communities, understanding what the needs, what the wants were, what the gaps were. We used quantitative and qualitative research in a big way, in an objective way. The Bucks and Froedtert don't have, you know, our objective in the way we look at this. I think the way we've kind of brought in partnerships, whether it's like, you know, other sports teams and entertainment entities, our public sector, other healthcare providers. This is a systematic change of the way to think about how to affect change in our communities that desperately needs it. When we're talking about the life expectancy of brown and black citizens, in these specific neighborhoods are more than a decade, you know, in years from white citizens of the city of Milwaukee. It's kind of a surreal type of thing. So when we looked at this, we said, 20 years from now, how do we lessen that gap? Because that's the pie in the sky. That's at 30,000 feet. We've got hundreds of thousands of community members that actually live 10, 12 years less than a majority of our population.
As Peter said, this is over 2 years of work. And the reason we bring that up, this is about getting it right. This is about being extremely thoughtful on the structure, having those conversations. It's more important to the communities than it is to anything that's publicity wise. We are very serious, and everyone around that table is really serious about improving the lives of Black and brown people in this community. So it's about more of taking our time, doing it right, partnering, collaborating, and not just rushing into anything, not just going out and asking for donations. This is about, here's what we want to improve, here's something specific, and here's how it will be sustainable going forward. So it's been a long time, but it's worth it. And the communities that we have here are very much worth it. And here are some of the agencies that we have up here. You can read those all, and they'll continue to grow as we go on, as we continue to develop. So we look forward to increasing partnerships. About our governance structure.
Yeah, I mean,
You're the leader.
again, this is more of like those that are interested in, and we are looking for contributors, not volunteers, like contributors. People who want to be engaged and involved, and we have handpicked, obviously through all of our citizens in the city, like people we think will help us accelerate and have real like centers of excellence as we grow this. But we are building an infrastructure to scale and scope and affect change in the city of Milwaukee over the next 20 years. We are going to publicly launch this in the next 2 months in a large way, where we kind of tell everybody what our total investment is. We've raised $5.5 million without saying a word. To date, this is something that I would say is, $50 to $100 million, like over time. This is a game changer of bringing private and public sectors together. This is a model, I'll tell you, kind of like what gets me excited is how we can be successful and take this model to every city in the country, especially if they're professional sports teams and healthcare providers who want to be the catalyst of affecting change and innovation in the way we look at the programs that we can put together in a big way. So this is what we've quietly been working on for a couple of years. This is a project with two large groups in your city that really are excited about the prospect of changing the way we really attack our issues in the community. To date, you can kind of see who we've got in, and this, I love this slide because it just shows you kind of the beginning of the spattering of who the partners are, but more importantly, what the resources are, and how we're talking about everything from housing to healthcare to safety and security to construction, of homes, to financing. These are all, really the pillars of how we have to build an organizations and centers of excellence around how we can really change the way we do things.
It's all often been said, it takes a village. So that's what we're looking for with all these partners. And as you see there, the NBA, how wonderful it would be with Aurora Health and their involvement with Atrium Health to do this in Charlotte, to do this in Chicago and other NBA cities with healthcare partners. That's what this is about. It's about the communities and partnering and collaborating and just making sure we just advance and sustain.
And just take you where we've been and kind of where we're going and how, this is an exciting time. We are going to affect this like you might think and look for federal and national grants. We are going to fund this in a way. We are going to resource it for long-term thinking, for long-term return. And, we're very, very excited about the prospect of making Milwaukee the model of how we can actually affect change and improve the lives of tens of thousands of people over the next decade.
And this is on top of all the work that the Bucks have done in the communities, all the work that Froedtert and the Medical College of Wisconsin are doing in the communities. So this is just very, very exciting. And ever since I got into healthcare almost 30 years ago, this is what I really wanted to do, be a part of. And so now it's a chance for me to actually give back to an industry that's given me everything that I have and a chance to work with a great partner, Peter, because he's been fun to work with. And if you ever get a chance to get on some of our executive community calls, it's entertaining. It's entertaining, but it's a group of folks who are extremely passionate about doing some good and improving these communities. So happy to take questions.
You guys shared them. First of all, thank you, Brent F. Wasson, Milwaukee Small Business Coach. Thank you very much for bringing such a great group of people together. My question is, you mentioned that over the last 20 years, there's been substantial investment, but not substantial change in outcomes. And you're trying a different approach here. Where is the balance, though? There's always a balance between we don't want to take immediate action that's not valuable versus talking for 5 years and not taking any action. So how are you going to balance that? And honestly, probably a little bit of the cynicism that may come with, yeah, we've seen it before, we've heard it before, where's the change?
Yeah, love it. Because we are happy with the cynicism. We are all engines ahead on affecting change and making this program work. We spent a lot of time kind of putting our plumbing together and our foundation, putting the groups together and vetting. And this is what innovation and change is about. This is like the city desperately needs a pivot in the way we really go after like some of our health issues, some of our security and housing issues. And we think it's got to be community-based outward versus kind of pushing back into the community. Be basic. I mean, that's the basic kind of juxtaposition of what we're talking about. And that's got to change. And we think if we organize it with incredibly intelligent, experienced resources and capital, that we'll have a great return. And by the way, we'll be measuring success every minute, every week, every month. So when there is not success, we can correct and pivot for success.
I would say also part of that is you don't necessarily have to, how do you say, be nice and just fund. You know, there are projects that come through that in concept absolutely support, but the first 2 or 3 things that want to be done don't make sense. Don't make sense from an investment perspective. Don't make sense from a how do you sustain this perspective. Your metric here, how does this get this metric? And having that dialogue, we're not saying no, we're saying, wait a minute, let's look at this. Let's see how we can now make this you moving towards your metric versus something that feels good. You know, that's what this really is about, and having the people around that table to have that dialogue. You're also teaching, learning. The individuals who are presenting this are learning as well because they get to talk with individuals who've done this over and over again. That's also a little bit of the difference.
Good morning. Thank you very much for coming and telling us about this initiative. And it's bold, and I like that. But my question to you is, it appears that you're trailblazing this model, but are there other national models perhaps that we can learn from and leverage in our efforts here going forward?
You know, we've looked across the country at various different projects, and there are many of them around. You don't hear a lot about them. In Chicago on the west side, there's the West Side Project where there's something similar. When we talked originally, it was looking back at what was happening in Harlem with the schools and how that has grown, the Harlem Promise Project. So we've looked at different projects all around the country, and then also taking it from just a pure, how do we invest in the community? So we've looked at a little bit of both.
Yeah, I mean, we've looked at the Greenlight Fund. We've looked at best practices. We're big fans of stealing, borrowing, and taking best practices from everything. So I think the way we formed this was like beyond an educated, way of thinking about what has worked in the past. And then what's the customization for Milwaukee? We have, like, our communities are slightly different. We've got, even geographically, from the north side to the south side to little segments. How thoughtful can you be as you set this up?
Hi, In the interest of transparency, I do work with the I Have a Dream Foundation, Milwaukee. Thank you, Milwaukee Bucks, for supporting that. We hope soon.
It's a message from Barry Mendel directly.
Yes, it is, as a matter of fact.
I've got that, yes.
He comes in many sizes.
Yes.
Yes. But I am a fundraiser, and I do understand overall what your mission is. I'm not completely sure of what your process is. So I know that you're taking a holistic approach to neighborhood. I know that you have working with a number of partners. But I'm not sure how is an ask made to you? Are you looking for one individual partner to come in and say, I want to do this, will you help me? Or that's just not clear to me. And then I actually have 17 questions, but the other one is, this first three is, are the Brewers entertaining being part of this, or the Admirals being part of this innovation?
So let me address the first question. This is what's a little bit different. We aren't necessarily looking for funders to come in and say, I want to do this. We're talking with the community itself, understanding the ideas that they have from that, and then we're going out and now we're talking to the funders. Because again, this is about investment. So how do we take the community, talking with the community, understanding what the community needs? Because if you understand what the community needs, you have buy-in from the community. And now you match that with individuals in this room and the other organizations. And now let's work on something that can be sustainable. So that's how this works. Projects get presented to us. Our managing director, Wendell Willis, has done a phenomenal job working with the different communities and then presenting ideas. And we work and massage those. And then we go out, Marla Habert and the group and the other executive directors on the committee then talk about how do we then match what is needed in the community with resources. Sometimes it's dollars, other times it's services. That's what we're looking at. It's still about what comes from the community first with that buy-in versus just giving something on top of it. So that's the answer to the first question.
Yeah, I would just say our process too, the vetting process of programmatic stuff, which I think you're asking about, is how do we take almost like a grant system where we have proposals that we go through as an organization, vet with experts, validate, and consider for investment. So there's a process to vet kind of programs that come through us through the community organizations. And then I'll just tell you in general, the Brewers and the Packers are like the greatest organizations ever. And when they're ready and when we're ready, they're happy to come aboard. So they've been, just so the three teams have kind of through the last 5 years kind of all kind of put our arms around each other and really supported, community-based programs specifically in Milwaukee to get it done. And I think our conversations with the Packers and the Brewers are, we want you involved in this. We don't need you to help launch it, but they'll be involved as time goes on, which they've been incredible about.
Well, congratulations to Froedtert and the Bucks. This is Bridge and Build Sports with a Bigger Purpose, is what we've been pushing with Wagon for a number of years. The question is one of playing the long game. And as you know, in business, culture eats strategy for lunch. And if you look at some of the younger generation in terms of going to school or behavior in school, health habits, dietary habits, public safety, etc., you see that the culture, at least of some cohort of the young population of Milwaukee, is challenging to say the least. So if you're playing the long game, and the long game involves youth, and if Rob Hankin is correct that mentoring and youth leadership, peer leadership, and individual attention are all important, how do we address and how do you address the long game with youth in Milwaukee who don't want to go to school, some of them, or when they're in school are disruptive, don't have dietary and other habits that are good for their health, and when they're on the streets aren't constructive? How do we address the youth issue?
Yeah, the long game takes a long-term commitment. I mean, we've got to affect, K through 12 today to have a generation of change. And I think we need a program that has that long-term effect that basically reinforces dietary issues, educational, reading levels, math, STEM levels, that basically we've been doing it, in all of these segments and chipping away at it and not really having like a sustainable great program that does this over time and grows. So, that's one of the reasons we need a long-term look at this, because we have generations of MPS students that are just going away, that literally are losing their reading levels, their math levels, like are not reinforced. So how do you create a program that is funded, that has the resources, that embraces, these kindergarten kids like at the beginning of the decade and ushers them through high school in like a controlled, great way with the resources that they need? I don't think there's another way. I think it's been done fragmented, and done well in little clusters. But the only way you affect change in a community and over time is with a long-term commitment. And then we're trying to push the public sector to think that way as well.
Yeah, I mean, you're right, but think about it. If I do not have any access whatsoever to fresh food, how do you want me to have my dietary change? When 20% of all the real estate in my neighborhood is vacant, how am I going to, and then the crime comes into that. When I have the reading programs that are available to you, but yet it's not safe because it's dark and I can't get there after school. How can I do that? How can I, as a parent, I'm just struggling. I want my child to go to school. I want to help them with their homework. I want to help them with reading, but I'm only reading at a fifth grade level. That's what we have to get into. And we laid up in there about the social determinants. That's the important thing. That's what we have to get into, unapologetically and address those things. That's why kids want to go to school. But it's like, here's what I'm dealing with getting to school. Here's what I'm dealing with getting home from school. That's what we want to really work at. It's easy to set up convenience stores. We heard this with one of the neighborhoods. I can get chips and soda anywhere, but I can't get fresh food. So that's the piece that we have to work with. And some of this really started with one of the owners is saying, instead of just doing a food drive, why don't we do something more sustainable? Maybe we can look at a grocery store. Maybe we can employ from the community, use our resources there, investment. That's kind of how this thing really kind of started, with that dialogue, with that conversation, and going that way. Long-term investment, not what has been routinely done. Every time Terry and I work together, I get a little nervous whenever Terry comes up and asks a question.
I'm not intimidating. So I love this because in my mind, we talk about social determinants of health. I like to think of them as social influencers of health, because determinants is too deterministic, right? Because we're talking about trying to make change. We talk about change at the individual level, how individuals can engage in change to improve their health. We talk about change at the neighborhood level, and you have those things up there, which is wonderful to see. More access to fresh foods, more grocery stores. I wonder, when we think about health and what influences health, the next level, the next rung is policy. And so, have you talked about that? Do you have plans to address policy? A lot of money is going to be invested in influencing health in our community, and I don't know if we can fully actualize that investment without thinking about how we address policy.
Yeah. So have we talked about that in the beginning? No, we haven't. We know what policy is needed. It's taking that one step. That's why this is 2 10-year terms. It's going to take some time. It's going to take policy to help drive it. But the first step is, let's get some things moving and communicate it. Let people become aware of it. And then as it grows, with all of your work, all of your help here, we can then influence and direct policy.
But I do think we realize the importance and why we have the mayor and the county executive deeply engaged, because they will be involved. The more they're influenced and involved in this, the closer we are to affecting policy.
So the fastest ways to change a community and a business, as you know, is through collaboration and partnership. So I absolutely love what you're doing. But a question came up earlier that I wanted to respond to. I just want to respond to it because I don't think this is a question. And it is, what makes this different? And what makes the difference that you're doing successful? And I just wanted to respond to that for you, if I could, Eric and Peter.
If it's a good answer, we'll see. We'll see you after the answer.
When Peter first came to Milwaukee, the first thing he said he wanted to do was change the way we connected with each other. And he wanted to do it in a dynamic way. He wanted to be bold. He actually did it. And he wanted to bring the organizations to bear to be able to make that happen. And Froedtert was determined to make sure that it had a strong reach into the community. So the differential that I see that makes this work is the passion that the two of you have. Yeah, we can talk about the business acumen, and we understand business, but you are taking this personally. And I think the people that are in this room should know that. Why? Because you went to the community and you asked them, and they told you, and you didn't say, we're going to do it this way. You said, we're going to do it your way. And I appreciate that.
Yeah, that's a great answer. Accept it. Good answer.
Hello. The issues you identify, the 4 pillar issues that you're really focused on, are huge issues in our city. So interested to know, when you talk to the community, what were the bold initiatives that you heard and saw that got you really excited, that made you say, if there's more support behind this, we think that this is something that could be more be really successful and duplicated across the city?
I mean, we just take examples, UCC, like home ownership and financing and
That's my jam.
availability to capital. You know, programs that are working, that if we actually help capitalize, could accelerate and grow. And why couldn't you mirror that in other communities like around Milwaukee? That's a great example. But I will tell you, the awakening was sitting with, you know, several community groups in circles and hearing about what are the little things that can affect so much change. Like, there's not light in our urban neighborhoods. I know that sounds crazy, but go sit down with people who have strollers and kids. Go sit down where cars are driving on the sidewalk, and where We Energies folks will not go into the neighborhood without a police escort, so lights never get fixed. Go into parking structures that are dark. Oh, well, we can fix that pretty easily. We have a direct line to City Hall. We have a direct line to We Energies. We can get some lights like working in the neighborhood. We can change traffic patterns in a big way. Like, there are great resource community centers that people are scared shitless to walk to after dark. That's a big problem. You know, so it was this awakening that, again, it was so great for me because, you know, we can't tell you what the problems are, understanding what the problems are, and then going to the community leaders and helping prioritize like what those are. But I think they're huge buckets, right? You know, whether it's healthcare, whether it's work development. I mean, the other part is like, how do we change the labor force? How do we have a 10-year period where we look to employ 10,000 more people from these neighborhoods, so there's an income coming in to get it. I mean, these are all, it's a huge, like, you know, kind of challenge to get it done. But that's why we have to think very big. And that's why this is tens of millions of dollars. That's why it's a very experience and depth of like a board and experience. Why we've taken 4 like centers of excellence that are already doing things like the right way that we can expand on.
Yeah, when you're talking with the community, it is the simple things. It really is. We had one homeowner, business owner, clear out and behind his business all the brush, cut down trees, old cars that were there, fences, tore it all down. The reason was because of all the criminal activity that was going back there, because you couldn't see it. By clearing it all out, you could see it. You could see the homes across, and the crime went down. As he goes to get insurance, then there was like, well, no, you got to put up walls and fences. And he's like, if I do that, the element that is really hurting, that you're trying to protect me from, will come back because the line of sight will be gone. So it's a lot of common sense. You know, when things, in my view, when we talk about healthcare and sort of the business that some of us are in, it's simple answers. It's listening. It's the small things that begin to add up to major, bold change. When you're talking with the communities, it is small things that they want. If you can just do this, I can take it over from here. And that's what we want.
Hi, you've identified some ambitious far-reaching and long-term goals, and you're asking for a lot of money from investment from the community. How will you be monitoring progress along the way so that you can redirect if necessary? And how will you eventually measure success of the program?
So the measure of success is the closing of the life expectancy gap over 10 to 20 years. We're talking about lives, lives of Black and brown people that contribute to the community. So for me, and I think the people around the table, no amount of money is too much. And we're not asking so much for money as we're asking for the investment, the commitment into it, whatever that may be. I mean, it is literally not necessarily. That's why it's not so much, hey, let's give us a bunch of money. It's, wait a minute, we have something here. What do you have that can enhance that? And it may be a service. It may be in-kind services. It may be teaching. It may be employing. That's what we see as a difference that will make it work, by listening and then understanding we want your investment.
Yeah, and I would just say, Joanne, if it can't be measured, it doesn't matter. I mean, that's the way we do business. So you think about home ownership as an easy metric to measure in a neighborhood. Food deserts and nutrition is an easy, there are real metrics of healthcare, real metrics of home ownership, real metrics of employment. And those are like on a quarterly, on an annual basis, like how we direct success or not success, and having a disciplined, group of a board that says, continue to invest, and show everybody who does invest, in fact, the entire public, what the returns are like in real time. And we want this to be very successful and a model for how we go forward.
I love the idea that you're going to make this work. But one thing that comes to my mind as somebody who's been involved in global health for nearly 20 years is whether you've looked at models in developing country that might be applicable here. Because you're speaking to looking for models in the US, and I don't think you have one yet.
That's a great idea, is to look globally on this. So we appreciate that. Maybe we can sit down
I would love to talk to you.
Let's do that. All right. We have another investor right there.
My question comes from decades and decades observing and being involved in the criminal justice system. And it's a question I don't want to ask, but it's a question I think we need to ask. And it comes from, as I said, the criminal justice system, but I think the problems that we see there are so closely related to all the problems you have up on there. And the question is, can we build a healthy community based on single female-run family systems? And I said it so many times, I'll say it, I see young men coming through court all the time. And so often they don't know who their father is, or they wish they didn't. And this sad path that leads these kids through this life and on to prison is one. The question is, can we build a healthy community based on that kind of family structure? If we can solve all these other problems and invest all sorts of money, and that's not one of the core problems we need to address, then I'd be glad to hear that. But if it is, if that's at the core of the problem, how do we change that? I know we don't want to look at it because it's such a long-term problem. It's going to take so long to change. But is anyone looking at whether we can change the way we raise children in the community?
That's a deep one. And I'll start and say some of those questions that you're asking are real. And some of those things that people don't really want to hear. And so when you talk about the single female home, what you're missing is the many, many, many homes that have two black figures, two brown figures in them. What we have to change is if I steal a candy bar, if I steal some fresh food, let's go there. Why do I, as a black male, go to prison for 5 years? And why do you, as a white male, get your hand slapped? No, it's okay. It's all right. That's what we have to change. That's where we get into why does these communities look the way they look. It's intentional. We have to stop that. We have to ask the real question. We have to get uncomfortable with these conversations and then be intentional about, hey, this is the reason why this is this way. You know, when we sat down with many of these communities, we had those two dual parent homes. We have those figures in the community, you know, that serve as that surrogate in many ways. Particularly in the Black and brown communities, it's a village, and it does occur. There are those things that happen that gets highlighted. You know, when we talk about the car thefts, and we have a lot on our campus. You know, we sat down with the community, and here's the reason: those kids were looking for a place to sleep initially, and then it rolls on and on. That's what we have to stop. It still comes down to those social influencers that we have. If we continue to work on those things intentionally, you know, then over 20 years, it does change. But we have to change the policy. We have to change that criminal justice piece of it that says you get treated one way, you get treated another. Because I need the opportunity. Because just as many things happen in other communities, except the penalty is different. That's what we have to do a little bit different, in my opinion, on it.
Yeah, and I would just say,
Very much like the chance to continue that discussion.
yeah, and I would just say we mentioned before, how do we resource those families that need resourcing? Whether you're a dual family or single family, we've got parents that need to learn how to read above a certain reading level to teach their kids, to be able to do their homework with their kids. This is a bigger problem. We've got to start some parent education. I mean, and that's just one of several examples.
So John actually asked the question I wanted to ask. So, but it's related to incarceration and individuals coming back home from incarceration. Do you include that as in your charter as to what you're going to do and how you're going to help individuals? Because that's something I'm interested in. Rotary Club is interested in. The second question really is, if we have to make this successful in Milwaukee, the ecosystem around Milwaukee, the counties around Milwaukee need to be brought in and participating in it, because otherwise it becomes a boundary. It's just like that gentleman's house where he couldn't see what's happening on the other side because of all the cars and everything else. We have built ourselves an artificial boundary around Milwaukee, and everything outside is kind of like not, they have a different perception. Are you looking to change that?
So two-part, I'll talk about recidivism. So the Bucks Pfizer Forum has an extensive program over the last 5 years of literally work development with former incarcerated citizens. It's not one of our pillars to go, and we understand workforce development, and part of that is how do we acclimate, former incarcerated, into the workforce and have programs for that. And then I'll let Eric answer the tough one.
Let's work on these communities here first. And by working on that, then you automatically, in my opinion, begin to bring in those from outside. This is to be inclusive, but we have to focus on those areas that have been neglected in the past. That's what we're going to get to. Good morning.
Great program. But I have questions. I have lots of questions, but I'll just ask the one that's important to me, because the lady talked about social influencers. And for me, at our clinic, we see a lot of people with high blood pressure, from smoking the weed, from popping the pills, and doing all other types of things out here in the community that leads to them doing criminal things. Well, hip hop is a huge influencer on the young people in our communities. And I see it as a problem when you're rapping about Percocets and getting high and all of these other things. What are you doing to have those conversations with some of these record labels, because they are really impacting our communities?
I'll give this one. I'll say this. Yeah, but it starts with dialogue with the individual, the children. It starts with dialogue in the communities first. You can begin to go out after that, but first let's just handle what's at home by having those dialogues.
Yeah, and I would say just don't discount the power of what we think the brand of the Bucks and the players of the Bucks and African American, trendsetters and really social determinants are. Like, Giannis, Chris, Bobby, kind of involved in public service and messaging out, that's one of our direct effects that we can have in our community. It's not the music industry, it's NBA basketball, but it's like one of our PowerPoints that we can really use for good. I mean, Bobby Portis is doing public service announcements on reckless driving. We will do, alcohol and drug PSAs for doing. They want to be in the community. We happen to have an unbelievable group of players who have now been here for a while and want to be vested. The power of the player is a personality, and then the music. Listen, we've got major buckets of issues, with the music industry being one of the big influencers. But I think, we pick our areas that we can really affect, and having an NBA team that's wildly successful with global superstars helps get the message out.
And I would just say, and Peter knows this more than I do, but if you ever hear one negative story, believe me, there's 10 to 15 more positive stories. We need to talk about those more, of that those individuals like Chris, like Giannis in the community that are doing, because they do it sometimes without any fanfare and they don't want it, but there's very much good being done. Is that it? Again, thank you all for the opportunity.